Good morning, everyone. Good morning, Queensland. Good morning, distinguished members of the press pack. Sorry? Well, hopefully everyone's had a good holiday, so let's hope so. Anyway, good morning, Queensland. And can I start by saying some very good news today. We have 6 new cases, but they're all in hotel quarantine, so 0 community transmission. This is wonderful news. I'm quite sure that everyone's feeling thankful out there, and thank you for continuing to wear your mask. The mask, that's very important. We have 73 active cases in our hospitals, and the Health Minister will update you very shortly on vaccinations. There have been 5,396 in the last 24 hours, and our total vaccinations to date are 94,762, which is good news. Tragically, a gentleman has passed away. Dr Young will talk more about that. He was a dual British PNG national, but of course our condolences go to his family. He was a very sick gentleman. He was medevaced from Papua New Guinea to Queensland, and I do want to thank our staff that looked after him and took care of him. So thank you to all the staff that have been involved in that as well. So, of course, good news about the bubble that's going to exist between New Zealand and Australia. I had the opportunity to speak to the New Zealand Prime Minister Jacinda Ardern yesterday, and of course I invited her to Queensland at the earliest opportunity, and I hope that her family does take up that opportunity. She was out here, I think from memory, for the Commonwealth Games, which was just over 3 years ago. And of course I know she does like holidaying here. I know she's got a very busy job, but hopefully she can come here in the not too distant future and experience once again all the beautiful things that Queensland has to offer. And of course we've got National Cabinet coming up on Friday. Of course this is going to be very important. I know front and centre will undoubtedly be the vaccine rollout and making sure that we get transparency in terms of our numbers from both the state and the Commonwealth. We just want to remind everyone that we're responsible for 30% of the vaccine rollout. The federal government's responsible for 70% of that vaccine rollout. I also will be writing to the Prime Minister today about another issue that I'd like on the agenda this Friday at National Cabinet, and that is to hold a National Women's Summit. I honestly believe that now is the right time. Back in 2016, when I was, I think, the only woman on COAG, I actually asked back then the COAG leaders to support my proposal to have a national summit on the prevention of domestic and family violence. This was really important. It was attended by the Prime Minister and all of the leaders, key stakeholders, and it was really good to come together to talk about such an important issue. But I actually think the time is now right for our country to have a National Women's Summit. I think this is really important. To look at gender inequality, to look at economic inequality, to look at actions to address the gender pay gap, actions to address the superannuation gap, issues around addressing issues of affordable childcare. This is a huge issue for women out there in our community. You know, time and time again, my sisters have told me and other members of the community how expensive it is for childcare when you're working as well. So I think these are really big issues in terms of women's equality. I also think issues of sexual harassment in the workplace is really important. But what we've seen over the last few months is a huge wave of support for women to have their voices heard. And I think the time is now right to have a National Women's Summit. So I'll be writing to the Prime Minister today. I'll be asking the other leaders to support this. I'm happy to host it here in Queensland, or it can be in Canberra. That can be at the Prime Minister's discretion. But I think the time is now right. You know, every week our Cabinet meets. And, you know, I think it was really good to see yesterday the Prime Minister meeting with members of his Women's Task Force. But our Cabinet meets, we've got nearly 50% women in our Cabinet. We meet every single week and we talk about these issues constantly. We've been able to make huge inroads in Queensland when it comes to making sure that we have 50% women on our government boards, making sure that we address issues like domestic and family violence, making sure that we've set up a task force headed by respected former Judge Margaret McMurdo to look at the way women are treated in the criminal justice system. I mean, we sit around the cabinet table and talk about these complex issues all of the time. And now is the time for women's voices throughout Australia to be heard. And I honestly believe that if we are going to achieve equality in this country, then now is the time. Now is the time for us to have a National Women's Summit. So I'll hand over to the Health Minister to talk a little bit more about, Dr Young first and then the Health Minister. Thank you. Thanks, Dr.
Thank you, Premier. So no new community-acquired cases in Queensland in the last 24 hours, which is excellent. And thank you to every single person who's come forward and got tested. It's really important that we continue to do that, like those young men did a few weeks ago, and that led to us finding that cluster as quickly as possible. So please, if you have any symptoms that are all suggestive of COVID, come forward and get tested. Also, I ask that everyone maintain the restrictions that are in place, wearing masks, limiting gatherings, being seated when eating and drinking, until the 15th of April, because that's the period that we're most at risk, that we could still see cases. So, unfortunately, we did have that death on the 5th of April of a gentleman who was transferred to us as an urgent aeromedical retrieval from Papua New Guinea to Queensland. So he died from complications of COVID. He wasn't infectious at that time, which is why he was treated at Redcliffe ICU, and I'm very grateful, as we all are, to the staff there who managed him to the best of their ability to give him that chance. But unfortunately, he was very, very ill when he was transferred. So he is, as you've heard, a dual Papua New Guinea and UK national, and we were the most appropriate place to provide that care for him. So as we go forward, just as I said, please come forward and get tested if you have any symptoms, and if we could just maintain the restrictions for a little bit longer. Thank you.
Thank you and good morning everyone. Again, I reiterate that we do have these restrictions in place. We want to thank all the Queenslanders who are doing an amazing job. We're hearing very high compliance as far as mask wearing and sitting down at venues and checking in. So we do thank everyone for that and ask them to continue that practice. Of course, keep coming out and getting tested. It's good to see our testing numbers have increased today compared to yesterday. However, we'd still like to see those testing numbers stay high while we are still in this 14-day period. So we do want people, anyone who's got any symptoms, no matter how mild, to go get tested and isolate until they get those results. I do want to acknowledge and welcome the comments made by the Prime Minister yesterday in his acknowledgement that there has been supply issues in Australia, that there hasn't been consistency, that we still don't know the volume, and we don't have consistent volume coming out of CSL in Victoria each week yet. And so this has had an impact on the rollout. And of course, we heard the Commonwealth's plan going forward that it isn't their plan at this stage to have mass vaccination centres until supply is much greater and we move on to the general population. Currently, we have about 14 days supply. We have about 7 days supply of Pfizer in Queensland right now, around 14 days of supply of AstraZeneca. We heard Brendan Murphy confirm last night that states aren't stockpiling, but it is reasonable to hold a contingency in place to ensure that you have stock on hand. The Pfizer delivery that we got last Thursday will advise that we won't get another delivery for a fortnight, and that was 25,000 vaccinations. So we have to factor that in our administration of the vaccine over the next fortnight. Of course, we can use that as quickly as we can and run out and wait for that next delivery, but we are mindful that at this stage we have no confirmation there'll be another Pfizer delivery within the fortnight. So I'm very proud of our vaccination staff who are working tirelessly, we're seeing the vaccination numbers come up again yesterday, so 5,396. We are now at 94,762. So in all likelihood, by tomorrow morning, we would be hopefully reporting that we've had 100,000 vaccinations in Queensland, which will be fantastic. But I do want to acknowledge all of the health workers, and I also want to acknowledge what the Chief Health Officer and also the Premier has said. I want to thank the health workers, particularly the staff working in the ICU at Redcliffe Hospital who have worked with the gentleman who recently passed away, and we just thank them for their important work that they do each and every day, and to all of our staff working with the 73 active COVID patients we have in our hospital system currently, all those working in our testing centres, all of those working in our vaccination centres, and of course those health workers who turn up each and every day just to keep all of us safe. Thank you.
Thank you, Premier. The decision to allow travel between New Zealand and Queensland is fantastic news for Queensland, for the Queensland economy, for our tourism industry, and for everyone who is employed in it. Coming off the back of that bumper Easter, welcoming New Zealanders back to Queensland will allow our tourism industry to continue to recover. You know, before COVID hit, we welcomed 480,000 New Zealanders to our state each and every year, contributing $600 million to our economy. That means that they were our second biggest tourism market back when they could go anywhere in the world. There will be a period of time here where Queensland is one of the few places that they can visit, and so we certainly welcome them. We're looking forward very much to seeing them here. 38% of New Zealand-born Australians live in Queensland, and I know many of them have been missing their family and their friends, and this will be a chance for them to reunite and see each other, and I'm sure lots of people will be very, very happy to hear that. I finally just wanted to note the remarks from the European Union this morning. I think it's quite extraordinary. I can't recall a time before where a world leader has sought to clarify remarks made by an Australian Prime Minister, and I think it just underlines what the Premier and the Health Minister have been saying, how we need open, honest, transparent communication around this vaccine rollout and particularly around the supply issues.
Morning all. Just some quick wrap up in terms of the operations since the lockdown, which we are very, very pleased with in terms of the levels of compliance that we saw right across the community of Queensland. So thank you to everyone for taking the messaging very seriously. So we did nearly 3,000 intercepts across the state. We did 1,431 business inspections. We've handed out 1,925 masks. That's a very pleasing figure because whenever we have approached people and asked them to wear masks where they weren't wearing one when they should have, by and large, the people have complied with that and understood what was required of them and commenced wearing masks. However, on 13 occasions we've had to take enforcement action. So 9 penalty infringement notices have been issued, and 4 persons have been either arrested or issued with notices to appear before court. Very consistently with those instances, there are either people refusing to wear masks when they should, having been given multiple opportunities to comply with the Chief Health Officer's direction, and in some instances people stating simply that they do not believe that they should have to and there is no offence. Can I just reinforce to everyone that the Chief Health Officer's directions are law, and that's why they can carry that offence notice that goes with them, because it is a breach of the law, and we will enforce it if people do not comply with the direction when given the opportunity to do, and we have. And on the other instances, unfortunately, we've had to take action for people who are out committing other offences and who are also disobeying the directions of the Chief Health Officer. So consistently we see people that are flouting the law more broadly and also ignoring the health restrictions. Look, I'll leave it at that, but I just want to add to the comments I made around the road safety Easter campaign before Easter, where we aimed not to lose anyone on our roads. Unfortunately, we have lost 5 lives. I'll say that we in the police are very alarmed at the current death rate on our roads. This is concerning. We are at a very high level this year. We are doing absolutely everything we can, but enforcement's only part of the answer. our community has to listen to the messaging. People really need to take more care on the roads. We issued many thousands of infringement notices over the Easter break, yet we still saw people in what were horrendous weather conditions on some occasions just completely taking reckless actions, including speeds of up to 170 kilometres an hour in wet weather. Look, we're going to continue. You're going to continue to hear this from your police that we are concerned about the road toll and we really want something done about it. Thank you.
Happy to take some questions.
You know, the man who passed away was the former PNG government officer. Would you have a general, message to PNG or his family?
Oh, we just offer our condolences to the family. It's a very sad time, but I do know that our health professionals did everything they possibly could.
Do you know what strain of COVID he had?
My advice is it's the PNG strain.
How many people from PNG are we still having coming to Queensland?
We've actually reduced those flight numbers. So remember we asked for the 2 weeks reduction, and we're starting to see a sort of drop in the numbers of positives coming into our hotel quarantine. Like we had 0 yesterday, but today we're back up to 6. So we're monitoring that, and as I said earlier, we have 73 active cases in our hospital, and the total overseas acquired in hospital is 57, so it's still substantially high.
The majority of those are from PNG?
From PNG, I've got the number from PNG in Queensland hospitals today is 26.
To clarify with Redcliffe Hospital, was he sent there to be close to family, or was it?
My advice is that's where the ICU was, and Dr. Young makes those determinations about where they go.
So I guess why not? Obvious question: River or Brisbane or the PA, bigger hospital, more equipped, I presume.
No, all these hospitals have got ICUs. They know how to perform these functions. It's just a tragedy that he passed away. He was a very sick man.
Why aren't we administering vaccines on Sundays when other states are?
Well, look, that's we are still rolling out the vaccines, and the health minister gave you an update about how much supply we actually have, and I echo what she said, that it's good to see the Prime Minister acknowledge the issue is supply here, and we will methodically roll out our vaccine rollout, and as I said, we are responsible for 30%, and the federal government's responsible for 70%. But you know what? At the end of the day, we need this to work. We actually need this to work. We actually need a lot more cooperation. That's why I've asked for more transparency of figures in terms of what we put out our figures every day. I'm asking the federal government to put out their figures every day. Let's have that transparency. So I'm quite sure there will be a very good discussion about that at National Cabinet on Friday.
The relationship between Queensland and the Commonwealth has been up and down throughout the pandemic. Where is it at now? What needs to be done to improve it so the vaccine can be rolled out?
Look, I think the issues are the same across other states and territories as well. I mean, the issue is about the supply of the vaccine. But I'll tell you now, everyone at that National Cabinet wants the vaccine rollout to succeed. Absolutely. No question at all. Everybody wants to see the vaccine rollout succeed.
Do you think Brisbane and Canberra should stop those different?
Look, I honestly believe that there needs to be an acknowledgement that the Prime Minister did yesterday that the issue is with supply. That's what I have been saying for time and time again. And now if we have some increased transparency of figures every day, that will give the public a lot more confidence in the vaccine rollout. I mean, let's be very clear here. The vaccine rollout, you need to have the public confidence in the rollout.
States have been doing a lot of the political heavy lifting throughout the pandemic in terms of managing quarantine and borders.
Yes.
This is the federal government's first real test. How do you think the Prime Minister's going?
Well, Lydia, we need it to succeed. So, we actually need to get on with it, and the Commonwealth and the states need to get on with it. And like I said, they're responsible for 70%, we're responsible for 30%. So let's get those transparency figures happening.
The EU has denied claims that it's lost 3 million doses of AstraZeneca. Do these kind of greater supply issues concern you about the slowdown to the state rollout?
Yeah, well, Deputy Premier addressed that, but I think the supply is the critical issue here. Now, also too, we've got to remember we don't have those high numbers that we're seeing in other countries at the moment. But if we're looking at, the federal government's looking at opening up borders to other countries, I think New Zealand is a good first step, but I don't think we should be opening up to any other country until we have the vaccine rollout complete.
Premier, have you given up on the Wellcamp quarantine facility?
No, not at all. No, not at all. I mean, there is one simple question the Commonwealth needs to answer. One simple question. Are they going to allow international flights to land there or not? It all hinges on that simple question.
When will Queensland be providing the costings to the federal government?
Once we find out, will they allow international flights to land there? Simple question.
On the travel bubble, do you anticipate Queenslanders will need to get a test either way before they travel, or is that something that needs to be worked out?
I don't have those details. I'm quite sure that'll be worked out with the medical professions that meet the head of them.
It's obviously an issue for the federal government, but is there other countries that you would like to see put at the top of the list for travel bubbles to be arranged?
I honestly don't think we should look at that until, because there's all these other strains around the country, around the world at the moment. Let's get the vaccine rollout done, and then I think is the right time to have a look at that.
Just on the Women's Summit,
Yes.
do you think we need this, and why is it taking a state premier to call for this by the federal government?
Well, I think we do need it. I think the time is absolutely right, Lydia. I think in terms of, we saw the groundswell of support of women right across the nation with the rallies. Then you actually saw, that really good cross-section, that great journalism that Frances Whiting did from the Courier Mail, where she interviewed all these different women. And then it was all of a sudden everyone's got these shared experiences. And the more you tap in and uncover that layer, I think there's so much more to this issue that women have kept silent about, thinking, well, it's only happened to me. Well, it hasn't only happened to you, it's happened to a lot of women. And now is the time to address it, when women have the voice to do so. So I honestly think this could be a significant moment in time.
How do you stop it just becoming talk about?
Sorry?
How do you stop it?
We need to have really clear outcomes from it. So we do know that there is inequality and insecurity of work for women. Women were one of the largest proportional groups that were impacted by COVID in terms of their jobs. Felt less here in Queensland, but felt largely in other states. We have serious issues about sexual harassment. We have serious issues about affordable childcare. And of course, domestic and family violence is also another big issue that I know a lot of people have concerns about. So I think it's the right time, and it would be wonderful to see our National Cabinet endorse that proposal.
You mentioned bringing some of these issues to the fore. Why won't your department comment on sexual harassment allegations within some of your ministerial offices that have been put to you by Channel 7 right to information request?
I'm quite sure that right to information request is being addressed, Joel.
Do you commit to providing some answers?
Well, I don't do the RTIs, but through that process, of course, the information is given out.
Are you aware of the allegations?
No, I'm not. No.
You haven't been briefed at all about
No,
the
I haven't.
allegations?
No.
The state government's also not released an RTO request into the timetable for Cross River Rail as well. Can you dispute any suggestions that you're not going to meet the timetable of the budget?
Well, the Minister updated Parliament the other day talking about how Cross River Rail was on time. Okay?
Dr. Young?
Yes, sure, and then we'll finish up.
Dr. Young, how bad is the shortage of timber in Queensland hospitals? We keep hearing that there's issues in that there's some elective surgery delays. What's happening?
Yeah, those issues are being worked through at the moment. It's a national issue, so we're working through with all the states and the Commonwealth alternatives.
How many elective surgeries have been delayed in Queensland hospitals?
None due to that issue, but we did have elective surgery delays because of the outbreaks at PA Hospital.
Was it just PA or other hospitals?
Well, because PA Hospital had delays, that then flowed on to other hospitals because other hospitals had to pick up the urgent cases at PA. So there's been a number of delays through the system.
And we're hearing that there's meetings, like high-level meetings taking place without it. Is that happening?
Oh yes, of course.
Dr. Young, just on
Last one.
we're hearing reports of a number, or an inordinately high number of people healthcare workers that receive their vaccination coming down sick and not reporting to work the next day. In particular at the Children's Hospital, one team reported that up to 12 from that one team, 16 rather, than the team unable to come to work the next day after getting it. Are you aware of some of these high rates of illness?
Yeah. We know.
Concerned?
Yes, we know around half of people will get a significant response, which is a good thing. It means their immune system is responding and will be prepared when they get exposed to the virus. So we know this is a new, as we know, a new virus. People don't have immunity to it, so when they get the first vaccine, particularly of AstraZeneca, a lot of people do get a significant response. It means that they're in bed for 1 or 2 days. It's not serious, they don't need hospitalisation, but that's part of the issue with why we're staggering the rollout, because we don't want everyone in the ward to then have 1 or 2 days off. So yes, we're aware of all of those.
Turn some people off from coming back to get their second dose?
Well, we know that the second dose for AstraZeneca, you don't get that response. So with AstraZeneca, you tend to get a significant response to the first dose, not always, but usually the first dose and not the second, whereas Pfizer, you tend to get it the other way round. You tend to get that significant response to the second dose. So people are aware of that.
Okay, thank you.
Thank you.